So my, journey into medicine really began on the patient side of things. My father had his first open heart surgery when I was about 8 years old, and then unfortunately had to have a second open heart surgery when I was about 10 years old. The second surgery was quite traumatic, and he was in the hospital for over a month, and really after that went on to develop congestive heart failure. And my dad would get hospitalized, so I spent a lot of time in and out of hospitals growing up and through my teenage years until ultimately he passed away when I was a freshman in college. I definitely, can't deny that it pushed me towards a career in medicine. And despite the fact that he had a lot of cardiac disease, I didn't really decide to do cardiology until later in my medical training when I did a cardiology rotation. I do have a sort of a personal spiritual basis for my practice, and I really felt like I'd been called into doing that once I had that rotation. And I think it's really served me well having that experience because I knew what it was like to be on the other side and to really not understand exactly everything that was said when the doctors came in the room, and how much that really impacted the family. And so I try to keep that in mind when I'm communicating with my patients to make sure that they understand what it is that's going on with their condition, what we're trying to accomplish, what this is going to mean for them long term, and also make sure that they have a chance to ask their questions and that they don't feel like their questions are silly.